All right. So without further ado, I will kick it off to Casey, and here we go.
Thank you, Mark. Good afternoon, everyone. Thanks for this opportunity to speak with you all. My name is Casey Slive, and I am the Food Access Coordinator at Ohio Department of Health. And as you all are aware, food insecurity greatly impacts health outcomes. Sounds like you guys have had previous presentations around this, but just kind of a recap on this, that, it increases the risk of chronic diseases like diabetes, obesity, heart disease, hypertension, mental health issues, primarily due to inconsistent access to healthy and nutritious foods. And this leads to poor diet quality and nutritional deficiencies. So this is particularly concerning for children as it can affect their growth and development. So you all as healthcare providers have a very important role to play because identifying food insecurity and recognizing the importance of food insecurity and the role that it plays with patient health outcomes. So, physicians screening for food insecurity is crucial because it allows you all to identify patients that are experiencing limited access to nutritious food. And by identifying these patients, healthcare providers can help connect patients with necessary resources to improve their food insecurity and overall well-being. So, I was asked to share an overview of the different types of food access resources that exist across Ohio, and how you all and your team can help refer food insecure individuals to those resources. So, next slide, please. Um, again, you all may be aware of many of these resources, but there may be information you're not aware of. So we'll just kind of provide an overview of, the major food access resources that are generally available across the state of Ohio. Of course, there's more in addition to these, but hopefully this will be kind of a useful overview. So I'm sure you all are aware of the SNAP Supplemental Nutrition Assistance Program, which these food benefits are distributed electronically through the Ohio Direction Card. In our list of resources, we have a county agency directory. The Ohio Benefits Portal, is kind of a one-stop shop, for individuals to apply for, manage their benefits. There has been kind of an expansion in the ability for SNAP users to shop online over the last few years, which is great. So there's a resource for online shopping with SNAP in Ohio linked there as well. But yeah, generally, if a household size is below 200% of the federal poverty level, individuals are likely eligible for SNAP. So, here's also, at quick glance, the monthly income levels based on household size. Excuse me. All right, next slide, please. So, the Produce Perks program is a wonderful program. It's kind of the concept of, it's been called Double Up Bucks in other parts of the state, or was previously, or other parts of the country, or was previously called that in Ohio. But the concept is essentially stretching SNAP users' purchases on produce items. So the program generally provides up to a $25 free match on SNAP purchases for fruits and vegetables. The program has been expanding. It receives a USDA grant called GusNIP. They were just re-awarded a large scale, one of 8 states in the country that had the large scale GusNIP USDA award for this program, which is great. And for individuals to use Produce Perks, SNAP users show up at participating farmers markets or grocery stores using their SNAP EBT card, and then receive the match for purchasing fruits and vegetables. So this program is primarily at farmers markets and smaller grocery stores across the state. And there's the list of locations there. And then they've got a great 1-minute video that kind of explains the program. So Mark, if you don't mind pulling up that video, we can share that.
Sorry, I think I have to share that video. I can do my whole screen. Do we see the video now?
Yeah, it's not full screen yet, but yeah.
Okay.
With Produce Perks, your family can double your dollars for fruits and vegetables. Visit your farmers market manager booth before you shop for assistance. The process is easy. First, swipe your SNAP EBT card. You can exchange how much EBT or SNAP you want to spend for tokens. And Produce Perks matches dollar for dollar up to $25 per day with Produce Perks token. If you spend $25 of SNAP at the market, you get an additional $25 in Produce Perks tokens for free. Then, use your Produce Perks tokens to shop for fruits and vegetables the same day or even save them for future visits. Shop with SNAP EBT at participating locations and get free fruits and vegetables each day you visit. Get fresh and healthy food from the market to your home with Produce Perks.
Sharing that. So yeah, that's just kind of a useful overview of the program, but a lot of folks aren't aware of it. So again, the list of locations can be found there. They're continuing to work to expand into all counties of the state. But yeah, and they also do operate some of the produce prescription programs in the state as well. So yeah, so next slide, please. So next we're going to talk about WIC, which I'm sure you all are well aware of, but WIC is for pregnant and postpartum women, infants, and children up to age 5. So it's also for women who, yeah, again, previously had a baby, infants birth through 12 months, and then again, children up through age 5. So not everybody realizes that it can cover kids through age 5. So, it provides nutrition education, breastfeeding education support, nutritious foods, and referrals to healthcare and other programs. So, the eligibility list is linked there. A couple components to be able to pieces of the eligibility, individuals have to be present at the clinic appointment and provide proof of identity. They need to be residents of the state of Ohio. They need to be, determined by a health professional that they're at medical or nutritional risk, and then meet income guidelines. So at 185% of the federal poverty income guidelines. So women and children already receiving Medicaid, SNAP, or TANF are automatically eligible for WIC, and that's all the proof that they need. And another note is that ineligible women, men, grandparents, or caregivers can still receive the benefits for an eligible infant or child. So a good thing to be aware of. They also have an farmers market nutrition program. So that's in addition to their WIC, the main WIC program. And this program provides coupons to WIC participants to purchase, fresh local fruits, vegetables from farmers markets, and farm stands. So that's kind of additional coupons that eventually might be moving on to an electronic method here in the next couple of years. All right, next slide, please. So in terms of referring patients, you can use the referral form on Help Me Grow, which is the last bullet there. This form can be submitted by physicians or participants for self-referral. there are several youth and children's services on the referral form, and WIC is the last one. So then what happens is Ohio Department of Health receives the referrals with the, WIC being selected, and then we route them to the respective clinic for follow-up with the applicant. So there's also the list of the WIC directory and pre-screening tool to check eligibility as well. And stop me at any point if you have any questions. I should have mentioned that earlier. Then we have the senior nutrition program. So I know you all are obviously primarily working with youth, but of course, many of them have caregivers who are seniors. So still want to cover this. So there are several different senior nutrition programs, focused on nutrition, health, and wellness. There are the congregate meal programs that provide meals and also opportunities for social interaction and activities. There are the home delivered meals that provide, nutritious meals to the doors of older Ohioans who have limited mobility, are homebound, or lack transportation, also commonly known as Meals on Wheels. There's also the Senior Farmers Market Nutrition Program. So this is somewhat similar to the WIC Farmers Market Program, but it provides coupons for older residents that can be redeemed for fresh fruits, vegetables, and herbs. So that program did receive some federal funding to be able to modernize onto an electronic system this year. So this was kind of their pilot year in doing that, and they will be kind of on the fully electronic system this next year with the ultimate goal of getting all of the sort of additional nutrition benefit programs on the same electronic benefit program at farmers markets, because right now it's a lot on the farmers market managers to manage all the different types of programs and the different tokens and all of that. So it's exciting that Ohio is moving towards that. Yeah, so age of eligibility, that I know that information is on the local area agency on aging website. So I can, if we have time at the end, I can see if I can pull that up. So yeah, just looking here to see. Don't see it immediately. So I will let you all know on that answer. But all right, so next slide. Okay, sorry, I just pulled it up. So you have to be 60 or older for the farmers market nutrition program. So food banks and food pantries. So this is definitely, a common approach to addressing food access needs. In Ohio, we have the Ohio Association of Food Banks. That's sort of the broader statewide organization that supports the 12 Feeding America food banks. And within, from those food banks, there's over 3,600, hunger relief agencies, such as food pantries across Ohio. So in order to identify which food bank serves your county, you can look at the list at the Ohio Regional Food Banks link there. And each food bank, typically lists the pantries in their area. Also, freshtrack.com locates food access resources based on your zip code. So that's a really great resource to look at there. And then just another note, all of the food banks in Ohio are also really engaged in the food as medicine work. They've really been expanding their efforts there, and they compiled all of their stories and impact of their current food as medicine work into that link there. So if you're interested in the food as medicine work, that's one of the great resources to check out. Next slide. So kind of speaking of food as medicine, which I know is kind of a hot topic nowadays, but wanted to cover specifically produce prescription programs. So they're one of the food as medicine interventions. So they're a way for healthcare providers to provide free fruits and vegetables for patients with chronic diseases and lack of access to nutritious foods. Prescriptions may be redeemed in the healthcare setting or at local farmers markets, mobile markets, grocery stores, pantries, etc. So there are a growing number of these programs taking place across the state, and physicians can be excellent champions in helping to develop and implement these programs at their healthcare systems. So yeah, I am happy to, be a resource to help connect you to if there are existing produce prescription programs in your area, or if you're interested in starting one, I can see if, help you connect to potential partners in your part of the state. Right, next slide. So speaking of that, I part of my role with our SPAN grant, which is this CDC State Physical Activity and Nutrition Grant, is to support the coordination and expansion of produce prescription programs across the state. And so the first thing that I worked on within that grant was a landscape assessment of produce prescription programs earlier this year. And we were excited to recently publish this fact sheet that captures the findings from that landscape assessment. So please do check that out. And we are kind of in the early stages of forming a food as medicine coalition to work towards, hopefully eventually being able to get more, Medicaid reimbursement for food as medicine work in Ohio. So again, if you're interested in connecting with us around that work, please reach out to me. Next slide. I know we're coming close on our time here for my presentation, but so just kind of quickly, the other nutrition programs in Ohio, there's the National School Lunch Program, Summer Food Service Program, the School Fruit and Vegetable Program, and then new this year was the Summer Electronic Benefit Program, Summer EBT, also known as Sunbucks, which states had to opt into, and Ohio did opt in. So it provides funds for families with children to purchase groceries when schools and child care centers are closed. So more information can be in all of those links. Yeah, thanks. And then hub referrals. So when we're talking about how to refer patients to these resources and link them. You all may be already aware of this exciting kind of emerging work. Hopefully some of these programs are already connected with your health systems, but hub referrals, provide care coordination frameworks that enable healthcare providers, often community health workers, to identify and code, risk factors for individuals that they're serving, and provides kind of a structure to address and mitigate those risks through outcomes-based payment model. So there are several different hubs in the state of Ohio, as you can see in this map. And the links provide more information to those, so you can get connected to the hubs in your part of the state. And Unite Ohio is a coordinated care network of health and social service providers addressing social determinants of health by connecting people to these resources. So Unite Ohio is one of the kind of major pieces of the hub work, and they're continuing to expand across the state and have connections with quite a few organizations and programs across the state. So Unite Us has also partnered with CliniSync, and they will continue to are continuing their expansion to healthcare systems and health plans across the state. So CliniSync can provide support to health systems to join the network and integrate within their EHRs as well. Next slide. So just wanted to share a bit more about some other work taking place that my colleagues are managing. So the Creating Healthy Communities and HEAL grant programs are taking policy system, environmental change approach to community-led solutions related to healthy eating and active living work. So the healthy eating strategies, so I guess I should say these grants are supporting 42 local health departments to do this work across the state, as you can see in the map here. And the healthy eating strategies include farmers markets, community gardens, healthy food retail, farm to school, and more. So if these programs are taking place in a county where you reside or where you work, we would be glad to introduce you to the contacts, the Creating Healthy Communities or HEAL contacts at your local health department if you're interested in connecting and collaborating with these programs. So feel free to check out the website with more information there as well, or reach out to me if you'd like me to facilitate a connection. And finally, you know, a bit more about my role. So, you know, I work to support, you know, implement food access interventions and resources across the state. I provide technical assistance support, and in collaboration and share resources and more. So I'm involved in a lot of various state level efforts, such as the farm to school work. We've got an Ohio Food Policy Network, our Nutrition Incentive Network that supports the Produce Perks program, and others. So there's my contact information to connect further. So thank you so much for welcoming me. So any quick questions?
And like I said, I'll be sending out this presentation, so you'll have Casey's contact information and all the great links that were on that as well.
Well, thank you all for the very important work that you're doing and for your time today. And again, just happy to be a continued resource. But hopefully all of the information in this presentation can be a useful reference tool if you are you know, needing to connect your patients to these resources. So thank you so much.
Thank you, Casey. That was great information. We'll go ahead and move on to our data portion of the presentation. And we have Zainab again, our data analyst, here to kind of discuss some of the trends we're seeing.
Yes, thank you, Mark. So yeah, we looked at similar slides last month. We're going to keep looking at similar slides to this with an addition of 1 month every time we meet. So compared to October, we did see a significant increase in the maternal depression screening rate in November. Again, we hope to see this keep trending upward and keep seeing that number increase. Again, not all of the practices are doing maternal depression screening, so this only includes those specific practices that have submitted their data for November and that have the maternal depression screening for their patients. Next slide, please. Of those that were screened, we are seeing a 3% of those that screen positive. So again, it's a very low percentage. We hope to keep it low, and or provide resources to those that, you know, do test positive. Next slide, please. And then we have the newborn screening. Again, there are 3 portions or 3 parts to that screening. There's the cardiac screening, the audiology screening, and the blood spot screening. We are not seeing similar screening rates for all of those parts. For the blood spot, we are seeing the highest amount of screening for the patients. And then we have the cardiac screening and the audiology screening at about the same percentage, at about 67, 68%. We do hope to increase those cardiac screenings and the audiology screenings to about where the blood spot screening is. And we, you know, we can help if there's anything that we can do to help, but this is just to show you how you're performing as a practice, and to show you some areas of opportunity of where some additional work can be done. Next slide, please. Of those that were screened, we are seeing positive screens we're not seeing any positive screens for the cardiac test, for the audiology and the blood spot screening. We are seeing higher percentages. The highest percent for the uh, blood spot screening is because we're screening a larger number of patients, right? So you're more likely to catch anyone that screens positive. So that's why we're seeing higher numbers throughout old months. Next slide, please. For food insecurity, we just had a great presentation about food and food insecurity. So we are seeing higher numbers again in November than we did in October. It's still a pretty low number of screening. Again, this is only including the practices that have food insecurity screen. We're hoping to see that number increase a little bit further, hopefully towards the end of QI, where we would love to see that number at about close to 100 or at least at 80%. Next slide, please.
Yeah, and I'll just say real quick, a couple of our practices that have done food insecurity have spoken with me about how they're just now adding it and being able to track it in their EHR system. So we should see those numbers continue to increase.
Perfect. And then we are seeing a little bit higher of those that screened positive in November than they did in October, but it's not significantly different than what we saw in baseline and in September. So again, we hope to keep that number down and provide resources whenever we can. Next slide, please. And then we have the oral health screening. Again, we have those that were screened and then those that received the fluoride treatment, which we're going to see in the next slide. But we did see a significant increase in those that were assessed or those that were screened. And we did see also, again, a significant increase in those that received the fluoride varnish in November than we did in October. Again, we hope to see that number continue to increase, but so far the practices are doing great. So please, use this as a sign of encouragement to continue to provide those numbers to us and to continue to perform great. Yeah, that's the end of my slides. Every practice has their individual data or data that's specific only to their practice. I share those with Mark. They're available if anyone. I'm not sure, Mark, if you share those with the practices, but if anyone does want to see their individual data or does have questions, please let Mark know and we can schedule something to look at that separately. So again, thank you all for your hard work.
Thank you, Zainab. Yeah, I haven't sent out that individual data yet, but if you want to just send me an email, I can send out the individual practice data. Any questions about the data for me or Zainab? Again, it's great. We had all of our data in this month, so that's great to see. Just a couple of things for me on the housekeeping and for January, again, we'll hope to have our data submitted for December, the Friday before our action period call, which is January 15th. Which I do want to spend some time talking about as well. We had a little bit of a change in schedule. Originally, our January session was slated to have education on oral health, but we've had an opportunity presented to us from the Department of Health and one of our speakers about newborn screening. And I see Dr. Bowling's on the call. So Dr. Bowling, if you don't mind going into a little bit of detail about what exactly will take place in our January action period call.
Absolutely. And first off, thanks a lot, Casey. Thanks, Zainab. Those are great. Actually, everybody's making really good progress and great job, everybody, on getting data in at a busy time of year. And those resources were great that Casey had today. So thank you to both of them. As Mark said, this is sort of an interesting opportunity that presented itself. We are, those of us who've been doing screening, we've encountered some great questions that come up with quality improvement projects. What's the best way to screen? What's the best way to track it? How can we make our processes more efficient and more effective? And one of our speakers, Dr. Caitlin Krivchenia, who is from Nationwide Children's, a cystic fibrosis expert, has been working with the ODH on the improved cystic fibrosis screening. And that's actually been an area where we've all kind of encountered, like sometimes we get some confusing results. And what do you do with them? How do we do communication? There's a lot of questions that that ODH has, and that our centers around the state, our cystic fibrosis centers around the state, particularly the ones at our children's hospitals at Akron, Cleveland, Nationwide, Dayton, Cincinnati, all have are on the receiving ends of these patients with questionable cystic fibrosis and actual cystic fibrosis. So we have a lot of questions to be answered on this new screening. So in that, what's going on is that the major medical centers with some assistance from the Ohio Department of Health, are looking at how to be more efficient on their end. They're having a conference actually in February, a big statewide meeting to kind of discuss all this. Well, Dr. Krivchenia, who's going to be speaking with us and is one of our support members, she's going to be doing one of our quarterly webinars, said, you know what we're really lacking is the input of pediatricians who do this screening and what they need to see. And at first I was almost brought tears to my eyes because they're actually asking all of us who are in the trenches, which is great. And so she said, what about this group that does screening for AAP? And I said, I think they are a fantastic group to give us some ideas on what the state and what the centers need to be doing around cystic fibrosis screening. So in place of the oral health one that we were originally scheduled for January, because of the timing on this, we're going to be having a really important action period call in January, on January 15th. We're going to have a very short introduction, and then we're going to do about a half an hour to 40-minute focus group with all of you. We're going to send out some questions. I want you to be putting on your thinking caps over the next couple of weeks. Nothing to do other than just be thinking about it. What challenges are you seeing with cystic fibrosis screening, with newborn screening in general, with communications? And we're going to be actually sending out some questions as a prelude to that action period call on January 15th. And what we're going to do is we're going to have some prompt questions. We're going to really ask each of you. So please come first and foremost, and please come with your opinions and thoughts on what we can do, what the state can do, what the centers can do to make cystic fibrosis screening more effective and efficient. So we're going to ask you to really speak up, because ODH, the centers all really want to hear our opinion, and this is a great opportunity for us to weigh in and get the messages to the powers that be who actually set policy. So as Mark said, in place of our regular action period call, we're going to be having a little bit of a focus group with some particular questions that we want to hear from you, your answers. So be looking for an email from Mark and from me about what questions will be asked during that focus group. Think about your responses, and then also just become prepared in January to really let your voice be heard. If you can't make that meeting, and some of these questions strike you as like, boy, I really want them to hear my concerns about X, Y, or Z, relay them to us, because Mark and I can still collate all this information for Dr. Krivchenia. There may also be an opportunity for some people who are really motivated by this to actually kind of call in or Zoom into that meeting, that statewide meeting in February. So we'll talk about that also at the action period call. So it's going to be a different one that I think is really timely, really important, and where your voice is really valuable, and it's going to really feed in directly to the children's hospitals in the state of Ohio and to the Ohio Department of Health. So we're kind of excited about it.
Thank you, Dr. Bowling. I'll just add one thing is that we have invited some other practices onto the call as well. So you may see some guest stars at that meeting. They've been invited. And so there are about 6 or 7 different physicians that may also attend based on their availability that are not involved in the QI project. Other than that, I think we're all set for today, unless anybody has any questions about that focus group call or about the program itself. I'll hang on for a little bit here, or if you have questions, feel free to email me as always. But I hope you all have a great holiday season, and we'll see you in January.
Happy holidays, everybody.
Hi there.
Hi.
I had a quick question. When we were on the PHP call earlier, I wrote down a note about an event that was happening on February 20th, but I didn't catch which that was. Is that one of these action calls on the 20th?
No, the February 20th is what Dr. Bowling was alluding to, the actual cystic fibrosis.
Actual focus group.
Yeah.
Okay. Okay. All right. I guess I wasn't listening closely when you were describing it because you probably said that.
Oh, no, that's okay.
Yeah,
We had date changes and everything. So January
Okay.
15th will
Crazy,
be
Lynn.
the focus group with these practices in the QI project. And then February 20th is, I don't know if it's called a conference or a summit between the different leaders in cystic fibrosis and newborn screening.
Okay. Got it. All right. Thanks for that clarification.
Yeah, thank you. And thanks for coming today.
Yes, thanks. Thanks,
I'm
Lynn.
glad I did because I'm here at ODH and I knew about a lot of what Casey was talking about, but there were a couple of resources in there that I was really happy to learn about. So yay.
Yeah, there's some cool things going on that she mentioned that weren't in our other webinar. So that was good to hear.
That was great, Casey. Casey, I had one quick question for you while you're still here. So you were saying that like you were talking about a senior caregiver who can still pick up things if the child qualifies, is what you were saying.
Yep, with WIC. Yep.
That's great.
Yeah, that was new to me. Actually, I had sent that slide over to my WIC colleagues to make sure it was accurate, and they shared that talking point, and I thought that was really interesting.
That's something that, yeah, you just don't even like, yeah,
Yeah,
that's going to be virtually almost all those situations. You know,
definitely,
when it's a grandparent taking care of them, they're taking care of them because there's an issue going on.
for sure. And I know the WIC program is really trying to increase their participation rates, in terms of there's a much higher percentage of individuals who are eligible than who are actually enrolled. So definitely good to keep sharing the information about that program.
That was great.
Yeah. Well, good to meet you all.
You
Yeah,
too.
I'm sure we'll be communicating in the future.
Good. Thank you.
Thanks.
All right. Take care.
Bye. Thank you for managing all my multiple sign-ins there, Mark.
Oh, you're good. You're all good. Technology is great unless it isn't.
Perfect.
All right, I'm going to sign us off.
Great.
Have a good
Thanks,
one.
Zainab.
Bye.
Bye.